I'd like to welcome everyone to the JCPA Delegates Assembly on Policing and Public Safety. I'd like to remind everyone to mute your audio and block your video during the presentations. My name is Michael Fromm. I'm chair of the Jewish Council for Public Affairs. It's great to have almost 190 people registered today and more than 80 JCRCs and national agencies represented on today's Zoom call. The Delegates Assembly is the highest deliberative public policy body in the community relations field and brings a network of JCRCs and national agencies together to grapple with the pressing issues of the day and to educate, advocate, and mobilize. The grievous killing of George Floyd and the national response has sparked the most significant conversation around systemic racism in America since the 1960s. And it came during the COVID-19 pandemic that highlighted racial and economic disparities that exist in our country today. That these issues have been raised to such a level is a clear call to action for our network. JCPA and the Community Relations Network must be a leading voice in the Jewish community on ending racism, hate, and bigotry. We have a strong history on civil rights and have spent the past 4 years educating and advocating on criminal justice reform. We are ready to engage in solidarity with the Black Lives Matter movement to work for revisioning public safety in our communities and our nation. I want to thank everyone for making this session a priority today. And I want to thank our criminal justice co-chairs, Faye Taxman and Bruce Turnbull, for working with Melanie Roth-Gorelick and the JCPA staff to create an important program with tremendous speakers who will help us take a deep dive into these important concerns. Now I'd like to turn the program over to David Bohm, JCPA's Policy Advisory Chair. David?
Thank you, Michael. Hello, everyone. I'm glad you've taken the time to attend this very important Delegate Assembly meeting. Particularly since the killing of George Floyd, we've been asked to take positions and engage in more substantive level on policing and public safety. In many ways, this is very different from the criminal justice reform work in which JCPA and many of our JCRCs have been engaging over the last several years. JCPA has been very active on the federal level, working with the Leadership Conference on Civil and Human Rights and in our national coalitions on this topic. We helped to develop and signed on to an 8-point platform of priorities that should be included in any federal legislative package. We submitted written testimony in support of this platform to several congressional hearings. We also passed a JCPA resolution on restorative justice in February, although as I mentioned, it does not address many areas or many of the issues which deal with systemic racism in policing that are now being raised in the public square. While JCPA is advocating on the federal level for changes, most policing takes place at the state and local level. So the positive change can only come about by involvement with our state and local governments and police forces. The current public discourse and advocacy is being framed not only about making changes to the way police interact with the public, particularly minority communities, but also around a fundamental re-examination of what we need to do to enhance and deliver public safety within our communities to everyone, regardless of color, creed, gender, or religion. We in the Jewish community, who have relied on police to protect our institutions, particularly since 9/11, will have to balance such protection against what is necessary to dismantle institutional racism within policing and to ensure that the public safety needs of all communities, particularly communities of color, are met in a fair and equitable manner. For many of us in the community relations field, this is a new issue, particularly at the local level. For many of us, it's been hard to sift through new terms and voluminous media reports to understand the policy issues and the proposals that are being put forward by advocates in this area. JCPA has organized this program to help you understand and make the case for engagement on these issues and provide you with the knowledge and a roadmap you need to have to be at the table where decisions are made in your state and local communities.
Thank you. Hi, I'm Pamela Rodriguez. I am President and CEO of TASC, Treatment Alternatives for Safe Communities, and the Center for Health and Justice. I have the honor of moderating the next panel. And on that panel, we will have Aqeela Sherrills, who is the Director of a community street team in Newark, New Jersey, and Jessica Nickel, who is the CEO of Addiction Policy Forum. I think I've been asked here today to talk with you all because TASC has been involved at a national level in areas related to addiction, alternatives to incarceration, sort of shrinking the justice system, and more recently, changing police responses to people with opioid use disorders. And so we're operating in that arena and have some perspectives that I want to share with you all. If you read some of the materials that were sent around, one of the ones that I think I want to use to frame the next discussion is about what we think police do and what police really do with their days, and what a day in the life of an officer looks like. And you heard some references to that in the previous discussions from Robert and Alex in particular, where they talked about police responses to mental health conditions, police responses to substance use, people with substance use disorders, and or people who are experiencing homelessness. Much of police work is dealing with social problems that are not in and of themselves crimes and or necessarily the kind of things that we're thinking they spend their time on. They're not all responding to murders and rapes and domestic violence situations in communities. And so what we want to talk about today is a little bit more about understanding what investments can be made and how safety can be achieved in communities without complete reliance on police as the problem solvers. Somebody asked the question about, can police be viewed as problem solvers? And when I think about that, I think about a phrase that I don't know how many decades ago I heard, and that is, when you're a hammer, everything looks like a nail. And so when your tool to solve problems is policing, everything looks like a crime. And I think what we're going to talk about in this session is how to understand public safety in a way that looks more broadly at community investment, more broadly at appropriate roles and responses for police, at community involvement, and how we can reshape responses in communities across the country that are meaningful to them, to folks at the local level. So what I want to do is, what we're going to do here is, we're not going to really do kind of like presentations. I'm just going to ask a couple of questions and ask Aqeela to respond, and then Jessica will have a chance to respond, and we'll do a little bit more of a dialogue. In that way, I might be able to pull in some of the questions that you all raise as well as we're going along. And so as we reimagine our approach to public safety, and as we even think about defining public safety, Aqeela, I'd like you to respond to that and let us know how you view public safety, particularly in the context of your work.
Sure. Thank you so much, Pamela. Yes. You know, first of all, for far too long, you know, when you say public safety, people say police. And we know that, you know, police are only one small aspect of the public safety process. I mean, you literally can't have public safety without the public, right? You know, public safety is not just the absence of violence and crime. You know, public safety is the presence of well-being and the infrastructure to support victims and survivors in their respective healing journey. And so you know, I've been a public safety advocate for over 30 years. I grew up in the Georgetown housing projects in Watts and participated in what many social justice activists call the longest running war in the history of this country, which were urban street gang wars. Between 1983 and 2003 in the city and county of LA, there were over 30,000 gang-related deaths. And it didn't include those who have been permanently maimed or incarcerated for the rest of their life behind their participation. So if you can imagine, the the high levels of traumatic stress disorder, hypervigilance, and vicarious trauma. These were literally kids who were, and young folks who were screaming out for help, who didn't speak the common language of the system, but because we live in a society that's still, controlled by structural racism and systemic violence and implicit bias, our cries, literally fell on deaf ears. The first 3 stories on the news are always about, some high, murder that happens in the community. And coming up in the culture in the neighborhood, gangs aren't inherently negative, right? But society gave us this label, and you would think that the whole neighborhood is involved in this gang war. Connie Rice, a prominent civil rights attorney in the city of LA, did a report, a call to action for the city, in which they discovered that less than 3 to 5% of so-called gang members were actually committing violent crime and murder. And so these 3 stories that we hear on the news, we came to understand that the label gang actually dehumanized the person behind the label and desensitized the public to the label, right? Because you could say that 3 14-year-old kids were shot and killed on Market and Broad, and people will be like, oh my God, those babies. But you could say 3 gang members were shot and killed on Market and Broad, and people will be like, they deserved it. We should lock up these animals. It'd be those same 14-year-old children, who lost their life. These labels that have been created to dehumanize, to scapegoat, and to criminalize young Black and brown youth have been horrific. And so in 1992, myself and my brother and a group of friends, we organized a peace treaty in our neighborhood that changed the quality of life in our community. In the first 2 years of the peace treaty, gang homicides dropped 44%. The city of LA adopted our strategy and created this Bridges 1 and Bridges 2 program, which eventually became the GRID, the Gang Reduction Youth Development Program, which is one of the most successful community-based public safety initiatives in the country. We had 10 consecutive years in a row of decreases in homicides and murder. There's evidence-based practice, evidence-based, sourcing now that speaks to that gang intervention without police has saved the city over $100 million and has prevented, some 58 murders in the city. However, even with all of the success, over that 10-year period, the LAPD's police department budget doubled and quadrupled, $2.5 billion in terms of investing in policing. And community-based intervention, although it has a line item in the general fund, is about $11 million a year. It's ridiculous, the amount of resources that we've invested in policing, whereas we have evidence-based practice from all across the country now that shows that residents trained as public safety professionals, engaged in conflict resolution, in mediation, in assertive outreach, and trauma-informed practices, has a greater capacity to be able to reduce violence and crime to a peaceful outcome than policing. And so I believe that, that these initiatives that we operate now in multiple cities across the country, and I'll talk a little bit more about the work that I'm doing in Newark, after my colleague has an opportunity to speak, has been highly impactful. And there's time, now time for a reallocation of resources and complementary strategies for public safety.
Thanks, Aqeela. Jessica?
Thanks. So I'm the founder of Addiction Policy Forum, and we work with all stakeholders and families and individuals who are struggling with addiction to have better outcomes for our patients and to have more innovative solutions that exist to deal with addiction. Police and law enforcement, really are a partner at the table in terms of identifying innovations and interesting things that police are doing nationwide to address opioid overdose, how we engage all sort of patients that are struggling with behavioral health disorders, whether that's mental illness or a substance use disorder. And so raising those strategies up and making sure that we have a dialogue and conversation about how we can all improve how we are engaging individuals struggling with addiction is really at the heart of the work that Addiction Policy Forum does. When it comes to public safety, it's interesting because you'll see very different responses to addiction based on a department, right? The level of training and understanding that sort of they have about addiction as a health condition, but we're also seeing some of our most interesting innovations on how you engage people with healthcare. And these innovations aren't about keeping that response within a criminal justice agency, but about partnering with the community. So law enforcement being a conduit and a connector to sort of reroute a lot of these cases. And sorry, my phone won't go on do not disturb for some reason, but how we reroute and make sure that the other community players that are so critical and vital to our response to individuals that are in crisis, to our response to healthcare conditions, are engaged. So a few examples from around the country. Nearly 20 years ago, Boston Police Department instituted a co-response unit where they brought in social workers, psychiatric social workers that were trained, that responded with the police unit with the officer, or engaged and provided services to individuals that were in the middle of a mental health crisis and their families, instead of that being a law enforcement only call. These are innovations that we see that have tremendous improvements community-wide, right? It is not just that one family and that one patient that is improved, but the whole community improves by having these different frameworks for approaching really, important issues such as how we respond to mental illness in someone who's in crisis, which when you don't have trained individuals can de-escalate, unfortunately, very quickly. What we're seeing though is, as these amazing innovations, they don't get replicated, right? We don't see them spreading like they should into all communities. We've known for 20 years that co-response units work, that de-escalation training and CIT training, and really sort of the solutions when it comes to serious mental illness and mental illness crisis are about connectivity to the mental health system in that community, training of officers, and really making this not a police-only responsibility, but they are engaging and creating a network of services and a safety net for that, that issue within their community. And then how do we make sure that those are replicated, right? So we make progress, and then we hit situations where jurisdictions think that they have to come up with their own solution, or they're reinventing the wheel or on their own, and we don't create the connectivity to replicate what we know works and can make sure that we reframe really how we respond to this. Now, similarly, we all know that we're in the midst of an opioid crisis, which unfortunately it looks like it's going to become much worse due to the pandemic. We're seeing increases in relapse rates and overdoses and suicides nationwide. So progress that we've made and all the focus, I think we need to step up our game to address overdoses. Some of our really interesting innovations in how you respond to an individual have come out of law enforcement agencies and criminal justice. Again, not acting on their own, but being the connector and collaborator with health systems and mental health and substance use disorder specialty treatment within their community. A couple examples to call your attention to. We're located here just outside of DC, and in Alexandria, Virginia, the narcotics department has a response team that goes to the emergency room for every non-fatal overdose. We know that an individual who has experienced an overdose has a 70% or greater chance of having another overdose. And unfortunately, the risk of that being a fatality is very high. So how do we take that opportunity? We want to reverse overdoses and bring someone back to life, but we also want to use it as an opportunity for engagement and treatment. So Alexandria PD, their narcotics division, sends a unit out to engage with that individual after a non-fatal overdose. They have a partnership with a behavioral treatment provider, with a addiction treatment provider, and there's a bed waiting for that individual, and that phone number is given and a burner phone is given to them so they can make that call directly either to that officer who's going to be sort of their connection to the department, or to the social worker and case manager that's a part of that community partnership that they have. So these are innovations that we know work. Relapse rates are lower among the participants in the Alexandria post-overdose intervention. We know that they have higher engagements in treatment because you have a trained officer who understands addiction as a health condition, who is empathically engaging, and it's a conduit, and they've connected to the community. So when we look at law enforcement as a part of the community that's making the required handoffs and collaborating with the different stakeholders that we need to be a part of this. We can see dramatic change. We just don't see these successes being replicated as far and wide as they should. Similarly, we have in 24/7 police departments like in Ohio, in Illinois, Pam's home state, and in Delaware, where the police department opens it up. Some fire stations have done the same, to say, if you are struggling with addiction, come into our department 24/7. There's no charges, there's no criminal, a plainclothes or civilian person will wait with you until we get you a bed the same day. So these innovations that we see are really about connectivity. And when we start to pivot to use this sort of new frameworks on how we can help so many people in crisis and their families, it not only helps the community as a whole, but it re-envisions, I think, the role that police can play in helping with these different issues as a helper and a connector, and reframes that in a way. The outcomes that we've seen, I think, are positive, and we need to have more innovations, but also to get the word out more, which I think your members can help us understand where are the solutions and how can we have concrete ideas and pieces that we can plug in that can, really render immediate improvements within our communities.
So one of the benefits, or one of the issues and barriers that comes up in some of these examples that Jessica is talking about is, and you heard her talk about having dedicated resources, treatment resources, beds, et cetera, available for people who want to access treatment. One of the things that law enforcement complains about, I think, in communities is the lack of resources available to respond to mental health, substance use disorders, homelessness, et cetera. And if they get involved in solving that problem, not at an officer level necessarily, but at a strategic level, at a leadership level, they can also, frankly, inform redirection of resources and reprioritization of, access to care, et cetera. Aqeela, when you go into communities and do some of your violence interruption work, I'm assuming, I'd like you to talk a little bit about that, but I'd particularly like you to talk about it from the perspective of accessing needed services and supports and resources in communities that have, historically suffered from structural racism and endless divestment and systemic, lack of resources, and not just individual poverty, but community poverty at the education level, and healthcare, et cetera.
Absolutely. I'll speak specifically about, the city of Newark, where I've been working for the past 6 years, running the city's community-based public safety initiative. The South Ward and the West Ward of the city of Newark have been known to be highly violent communities. And, one of the primary reasons why is because there's been a lack of investment in people and infrastructure in these communities for the past 50 years. And so the trauma has been allowed to ripple and just to fester because, Black folks, unfortunately, aren't seen as victims in this culture. Victims are upper middle class white women who live in suburbia who are suffering from domestic violence and sexual assault, right? And so a few years ago, we launched a whole new movement called the Survivors Movement, because folks, victim has a negative connotation in our community because a lot of people were justice involved, right? And we wanted to speak to that, a survivor is someone who has had an experience and conceivably doesn't want it to happen to anybody else, and that they're engaged in their respective healing journey. And so the work of community-based public safety or violence intervention is not just interrupters or just, intervention. It's one aspect of a multi-pronged strategy that actually creates safety in community, because safety is something different in the Black community than it is in the white community. Because of the history of colonization and white supremacy in this country. It means something different, especially in terms of law enforcement. As Dr. Brown talked about, the history of law enforcement in this country is rooted in, returning enslaved people into bondage. You know what I'm saying? And so when you look at community-based public safety, it's high-risk intervention, it's safe passage around schools, it's victim services, and then it's advocacy work, right? One aspect of our work is that, we hire people specifically from the neighborhood. We train them as public safety professionals, and these are, credible messengers, non-traditional leaders, ex-gang members, ex-convicts, ex-drug dealers, who are redeemable human beings, who've changed their lives and they've atoned for the wrongs that they've perpetrated, and now they're engaged in the community to bring healing. And so they intervene in conflicts because they have relationships. We did a study with Rutgers University in 2015 and looked at and learned that 62% of the homicides that happened in the city were all domestic disputes, that actually led to violence because no maintenance was provided in terms of intervening and resolving these conflicts over a long period of time, right? One of our individuals get hurt in the community. They go into the hospital. We launched the city's first hospital-based violence intervention program. So we have credible messengers who are embedded in the hospital. And so when individuals go there, they get sewn up by the trauma unit. When they get ready to transition out, we develop a safety plan, because the number one, way that people can access education or healthcare or any of those things is that people first have to feel safe, right? And so we meet with them, we mediate the conflict that potentially sent them in the hospital. So when they come back home, or we help them, with their victims' comp application and help them get emergency relocation. We do a lot of advocacy in this community as well, in policy work. We recently hosted yesterday the Attorney General of New Jersey at our public safety roundtable, because the Attorney General responded to some of our requests and they reformed the whole victim services unit in the state. Because if you have an open warrant, you are disqualified automatically from receiving victim services in the state. They have another little clause in the contract called contributing behavior. So say you're out hustling in the streets because of quality of life issues and you get shot and killed. They'll say that was a contributing behavior and utilize that to deny you services, counseling services. If you lose your life, they'll deny the family resources to bury their loved one. So they punish the family as well, And so there are lots of restrictions and barriers that have been put in place for folks in the community to be able to access healing services. We also work with our law enforcement. I think that in the past 6 years that we've worked together, we've really changed the image of how community actually sees law enforcement. We work with the Equal Justice USA, and we instituted a program called Trauma to Trust, in which we have the community and law enforcement, over 300 cops at this particular point, go through a trauma training so that they can understand and recognize their own trauma, as well as the trauma that the community suffers. So that when they meet folks in the neighborhood and on the block, they understand their role and their responsibility much more intrinsically, that they are then connected to the communities in which they serve. Because unfortunately, our cops, our officers experience a high levels of vicarious trauma and traumatic stress and hypervigilance as a result of the line of work. And unfortunately, if they even speak about having some type of, emotional or psychological challenges as a result of the work, they'll get de-gunned and deaths immediately, which threatens their ability to be able to provide for their families and their loved ones, right? And so we only the community, only the public can actually advocate for officers like real safety and health and well-being. We want them to get the proper counseling and therapy and whatever healing modality is necessary so that they can be true public servants and not bring a lot of the trauma that they suffer through the work and take it out on the public, right? The number one cause of death for cops is suicide. And we know who experienced the brunt, of their trauma when it goes unaddressed. It's their husbands and wives and their families, And so there's a tremendous amount of work that we have to do because they're not superhuman beings. These are our uncles and our brothers and our aunts and mothers and sisters, who are serving in these capacities. They're public servants. And so we treat them as such. We understand that they work for us and it's not the other way around. And so we meet with our cops on a monthly basis. They share intelligence with us about situations that are happening in the community because the community will have more intelligence than they will ever have because 80% of our officers in the city don't even live in the city limits. So when we call them, they kind of come in and attempt to address the situation and then afterwards they leave. But when you train residents as public safety professionals in conflict resolution and mediation and trauma-informed practices, then they're there on the scene when the situation happens. They're there to provide maintenance after the officers are gone. And so this is why it's so important that we reallocate resources to infrastructure. And to me, infrastructure is people, you know? It's people who have a particular skill set and relationship to be able to intervene in conflicts and help to bring them to a peaceful resolve. And then be able to connect, you know, residents with services like the Trauma Recovery Center, you know, where you can be a self-identified victim and be able to go in and get, you know, 16 weeks of services. This is another initiative that just came out of the AG's office in the state that the Newark Community Street Team was fortunate enough to be able to apply for that grant and to receive it. And so now we're going to be providing those services directly to folks, because one of the other huge victories that we had in terms of working with, you know, our public safety director, Anthony Ambrose, who is super progressive, right, was that we had an issue in terms of detectives putting suspect victim on police reports, which automatically disqualified individuals from being able to get victim services and qualify for emergency relocation. So these things are extremely important. So that you create, like, you know, a healthy environment, and also you prevent or you move that barrier out of the way from people seeing the police as the enemy, right? And even though, you know, like Newark PD has had a history of excessive force issues, you know, we have a current consent decree. You know, Mayor Baraka, his leadership in the city has been pivotal in terms of shifting, you know, our current public safety reality. Right? In the past 5 years, we've had consistent reductions in violence and crime in the city. In 2019, we had a negative 48% reductions in homicide in the South Ward. You know, I mean, so it tells you something about this community that's working together, you know, with our law enforcement. And then just last week, you know, the mayor put forth an ordinance to move 5% of the police department's budget, which is $230 million a year in a city of 280,000 people, right? Moved 5% of the police department's budget into a new department of violence prevention and trauma healing, so that he could actually co-locate all of his public safety initiatives in one place. We're taking the old first precinct, which was the location where the Newark Rebellion broke out at. And you know, a lot of people don't know, but that the Newark Rebellion, just like the Watts Rebellion and many other rebellions across the country, were due because of excessive force by police, you know? And so we're gonna turn that department into a museum, you know, on the first floor, so that we can show the history of activism and advocacy in the city of Newark, but also collate our programs with law enforcement, having an office there, but also hiring community navigators who serve as, who are licensed, you know, social workers. It's important, you know, in terms of language, because, you know, we heard the Trump administration put out their reform bill, and they talked about, you know, putting social workers inside, you know, the police department, giving money for the police department to house social workers. You see, in the Black community, you have to understand what a social worker is. Social workers are associated with DIFAS, with the Department of Children and Family Services, that take people's children away. And in a place like Los Angeles County, where Black Americans only make up 7% of the population, they're 57% of the cases of the Department of Children and Family Services. This is a broken system, and it's been broken forever. And people see it as an extension, you know, of the system of enslavement in this country, in which they've taken Black kids and they sold them off. And they literally, if you fail 2 drug tests, you know, after your children has been taken away with the Department of Family Services, they will put your kids up for adoption. It is barbaric. It is, you know, a system that needs to be reformed. And so, you know, there are a tremendous amount of changes, and I'm happy to be, you know, a part of the city of Newark, under the leadership of Mayor Ras Baraka, because he's a visionary, and he put these systems in place, you know, some 6 years ago, and now we're seeing the fruits bear. And I think that Newark is a model, you know, for how to reform and reallocate dollars without demonizing, you know, our cops.
Without demonizing cops and without a risk to public safety, I would add.
That's right. That's right.
Jessica, I know that you do a lot of work with impacted families, and I know they have expectations and needs when it comes to police response, when it comes to safety, when it comes to concern for their family members. I wonder if you could sort of speak from the voice or the perspective of some of those families that you work with who might want to weigh in on a conversation like this with regard to what does community investment look like, what does police response look like in a substance use or mental health crisis.
Yeah, you know, so from a family perspective, 911 is still a default, you know, response when you're in crisis or experiencing an emergency as a family member. So the idea that that would not exist for families who, and you know, and there can be some, unfortunately, some very difficult situations that our families are responding to or dealing with, domestic violence situations, individual that really is in crisis and needs a high level of care. So there can be quite a bit of concern that in just discussing ways that we can improve our police responses to make it more fair, equitable, to advance it and, you know, bring it into sort of this next level of sophistication and safety and fairness to all, that we don't dismantle our emergency services system that so many people rely upon. So there can be a little bit of fear from our families there. And this is all families. Now you have a little bit difference in reliance upon police services based on race and ethnicity and your socioeconomic position. So I think we have to factor that in as well, that this is a safer call for some families to make than others. And that is something that I think we need to keep at the forefront. But regardless of that, our whole community wants that to be in place as sort of a safety net or safeguard to make sure that, and particularly if we have systems that are sophisticated, that understand what crisis looks like, that are well trained. I agree, Pam, with your earlier statements about when we underfund some of our needed services, whether that's for mental illness, addiction, homelessness, domestic violence, victim support, we underfund those, there's not other phone numbers to call. There aren't other 211 and 411 lookups to figure out where to go when you're in need or in crisis. And that increasingly will fall back on police, who will get criticized for being the response, even though their community has not properly funded other needed services that are required. So I think we need to balance that between making sure that we understand the role that we have asked police to play in very tricky situations, right? And understanding how we bring other community services into the fold, that we make the linkages and the care handoffs that are needed without villainizing law enforcement, that we, by lack of building the other systems we need, we put them in the default position to handle all of this. In the addiction space, it's particularly acute because about half, not quite half, 48% of adult Americans don't understand addiction as a health condition, which leads into all of, you know, increased incarceration, increased negative responses, but it also leads to less engagement by the family members to intercede at earlier points in time, right? So some of our biases or our myths around this are sort of built into problems around how we see addiction. And so if we take away the systems that we need to engage, if the parent doesn't have the resources, if our healthcare providers, whether it's the clinic or your pediatrician, if our pastors and our priests don't know how to help us engage with a family member that's struggling with mental illness or addiction, I kind of like try to talk about sort of using your levers to help people and sort of get them out of this stream of crisis. And in our communities that we don't have these systems set up, it leads down to law enforcement, right? So by default, when we don't build the systems that we need to help individuals in crisis, we are leaving it at the door of the local police department or precinct, who may not have the resources or the training to handle all of these sort of varied crises situations. So I think that we need to take responsibility and raise up systems and approaches that are much more community-based, that look at police as a partner, but not as a default fixer of everything that bad happens in your home or your community. and really recognizing that and honoring and recognizing the leadership in law enforcement that have changed those systems and those responses and replicating them so we can do a better job of figuring this out and having safer communities, but more humane responses. But the answer is to not respond. You know, we have millions of families who are struggling with this, and the idea of having no one on the end of 911 creates a lot of fear for the majority of our members and people who are struggling. And I think that we need to be very thoughtful and comprehensive in our solutions that, you know, change the framework, but make sure that we don't end up with holes in our safety net system.
So I want to ask each of you, you each have 2 minutes, because at 1:58, we're going to be moved into breakout rooms. So Jessica, I'm going to ask you first. What we're going to talk about in our breakouts is, what does this mean for the Jewish community, the community relations field, et cetera? So my question to you, Jessica, I'll start with you, is what would you ask of this group? What can this group do to help address the concerns, issues, and needs that we've raised today?
Wonderful. I think, you know, just speaking from a bit of experience, and sort of all of your councils and members and sort of the network that you have created and the advocacy that you do so well can help us with solutions and to advocate at the local level as well as the national level. I believe that you all have been engaged in the criminal justice space for at least the last decade. Because we've worked with you all on improving our funding, our resources, and how we look at prisoner reentry as an example, right? 20 years ago, no one spoke about what it's our responsibility to make sure that people returning from prison and jail return with the right services and the right skills and the right connections. You know, it was, I do this work because of my family's impact and addiction. So my mom went to prison, and when you were released, it was released at 2 a.m. with $5 and whatever, you know, bag of your original personal items that you have, and not a lot of notice to your family that you were coming out. It was sort of release people with least possible good chances of this being a second chance instead of the continuation of a cycle of incarceration and difficulty. And we changed that. We changed that fundamentally as a nation. Our viewpoints on this, our funding has changed. All 50 states have a different way of looking at reentry. There are always rooms for improvement, but your members have helped create some of that dialogue change and advocated for new innovations and solutions in other criminal justice arenas. I think that there's space for you to engage in this one, to talk proactively about what cities and counties and states, with the federal government, all of the different policymakers and players can do to use this opportunity to see implementation of real change and reforms that are going to be transformational. And your advocacy, I think helping and being a partner in this, I think is crucial.
Thank you, Jessica. Aqeela.
Yes. Just in real specific, you know, we need your support and your advocacy around what Alex Vitale, you know, spoke to so eloquently, that this is a community safety movement. And so we need both national and local support, you know, for community-based public safety strategies that are happening on the ground, that are evidence-based, that are practice-based, you know, that are working. In the state of New Jersey, we have a bill, you know, S3309. I'll say it again, S3309. It established the New Jersey Violence Intervention Program. However, this initiative is not funded yet. You know, we need about $20 million to be moved into that initiative to provide more support for work like the Newark Community Street Team is doing on the ground. You know, Camden has a really robust program that does community-based intervention that has been working. The Newark Anti-Violence, the Jersey City Anti-Violence Coalition in Jersey City. These organizations need resources so that they expand their training capacity, they expand, you know, their strategic partnerships with law enforcement and hospitals, and, you know, and are able to, you know, advance this whole frame around violence as a public health issue. Violence as a public health issue is not a tagline. It has real implications and real practical steps that could actually happen on the ground. And so we need more advocacy and support for our work. You know, and just another thing, in terms of where do we find the money? As Alex said, we have to rein in, you know, the Jewish community has a tremendous amount of advocacy power. And we need you to help us to rein in politicians' support around, you know, reallocating dollars from police to more community-based strategies. As Jessica is saying, we're not trying to, you know, defund the police, you know, and no one's gonna stop, you know, responding to 911 calls, you know. It's, however, we respond to the police dispatch in the city, our high-risk intervention team. But I tell you, we get that call almost an hour and a half late, you know. Second save lives, as one of my brothers, Prince, says from New York, right? Second save lives. And sometimes we're on the ground and we can respond to those situations much faster, you know, when there's technology involved, right? The Citizen app, you know, different things like that. But we need advocacy, you know, and folks to really understand that in communities of color, that safety is different from in white communities, right? And that it's not just crime stats that actually tell us what safety is, and that safety is just not the absence of violence and crime, but the presence of well-being and the infrastructure to support victims and survivors in their respective healing journey.
Oh, that was a great closing statement. Public safety is not just the absence of crime, it's the presence of well-being. And I think we all can probably, that resonates probably with all of us, right? We are now, I think, Haya, gonna get moved into breakout rooms. I want to thank Aqeela and Jessica and everybody else who came before. You guys are all wonderful. Thank you.